Hello, I'm Dr. James Underberg. I have collaborated with Castle Connolly Private Health Partners to create Underberg CCPHP. So my path to medicine was a bit circuitous. I started out with an interest in science, biology, biochemistry, and ultimately got a master's degree in molecular biophysics and biochemistry. And my original plan was to ultimately get a PhD and do research. And in my training for my master's degree, spent a lot of time on the bench by myself and decided that I needed to be around people more. And so medicine was the natural evolution of that for me, and I switched gears and applied to medical school, and now I'm here. My decision to convert to a concierge model was one that evolved over a period of time. With some of the changing forces in medicine today, there has been a push towards physicians seeing more and more patients and spending less and less time with them. And inherent with that is also more difficulty actually getting in touch with physicians and other healthcare providers. I became frustrated with that, felt there had to be a better way for me and my patients, and so my decision was to do the opposite, which was to create space for myself within a model that allowed me to actually spend more time with my patients and be more accessible and give them more ability to interact with me on a variety of different levels and platforms. Once I made the decision that I wanted to change my practice, I actually investigated and looked into a variety of different companies that help in this process. Castle Connolly's name, their experience, and actually the service they provided to me and ultimately my staff here in the new practice setting has just been phenomenal. And it's really, I think, made the transition much easier, not only for me, but my patients. And the process itself has actually allowed me to be able to spend more time with my patients and enhance the healthcare experience, both for my patients, their families, and in some ways for me too. So it's really been a win-win for everyone. What's great about the Castle Connolly model is the variety of amenities that membership offers my patients. The one that I wanted to start out with, because it's very near and dear to my heart and the prevention focus of my practice, is the SENS program. SENS stands for sleep, exercise, nutrition, and stress management. These are all important features, not only in the care of patients at risk for cardiovascular disease, but for all the other areas of medicine that people come to see me for. And so the ability to reach out, have expertise in helping people deal with different aspects of these conditions, risk factors, and potential things that we can modify to improve the healthcare program for these patients, to me, I think is absolutely wonderful. So a second feature of the program that I think is just a wonderful opportunity for patients to take advantage of if they need to is the Castle Connolly Top Doctor Program. This is a network of over 50,000 doctors around the United States, all different specialties, and all different locales in different communities and parts of the country. If you're traveling, you have an issue, you have a problem, and you need to find the right doctor for your condition, the network can help put you in touch with the appropriate person, get you an appointment. That's really an amazing thing if you think about it, because if you don't really know who is the best person in the particular area you're in, having this opportunity to link in and find the right person, I think, is really key. One of the additional wonderful features of the Castle Connolly program is the connectivity that it offers. Connectivity to me, to my practice, to my staff, and that's 24/7. And it's a direct connectivity. You, of course, can call the office, but through a variety of different other opportunities, including the option for telemedicine, you can reach out to me directly through an app on my cell phone. I can even take a look at a rash if I need to via the app. It's really a wonderful opportunity for me to be able to care for you in a variety of different settings that are convenient and appropriate and timely for everyone. I think it's important that people understand that while my practice setting has changed and some of the features around the style of practice have changed, everything else is the same, including the way I practice medicine. This just gives me a better opportunity to be able to deliver the skills and the abilities I have in a way that I think people can better benefit from them. So in the end, I think this is a beneficial program for everyone involved in it, myself, my patients, and hopefully moving forward, we can all be healthy together.